How to work with failure to thrive and head malformations or hydrocephalus. It's for Emily, but for all of you, right? First of all, what needs to be done is where are we for medical? Now she has an NG tube. I'm assuming, right? Actually, I can't tell. Usually I'm pretty good, but I can't tell if that's an NG tube or cannulation. I'm assuming it's an NG tube. I don't see the double cords wrapped around the head, but I didn't zoom in. My question is what is this? What are we finally going to do about it? Are we going for a G tube, or are we going to keep the NG tube, and for how long? I know we have aspiration and vomiting. Unfortunately, what people don't understand is food is meant to go down, not to get meant to go back up. And so when we have those things, it can cause a lot of problems. Personally, I have to say this, and I haven't talked to Emily, so take it with a grain of salt. One of my biggest regrets is I didn't do an NG tube with my son. It is really nice to pop the tank and get stuff in. It takes, I'm going to explain what the NG tube is doing to her development, because it is delaying her, making her much more sleepy. This is why I don't like weighted blankets, because it's the weight down the esophagus, but we'll get to that. And so that's where you're at. But it would be great. My son lives up Pizza and Chick-fil-A, and I get it. He goes to college now, but I wish I could have popped that tank and put in spinach and omega-3s and all of that. But more so, my son has had 29 surgeries, 47 days in the hospital total. And he had hospitalizations just because when they just get sick, or again, that failure part comes in, you need to bring them in to get fed and hydrated. I know you're doing the NG tube, but the NG tube will affect development. The first thing is what you need to work with was, I know you're switching it out. That Tegaderm tape is really going to be rough. You've got the hydrocephalus, and you have the limited movements because the face is being taped, right? This is going to impair speech, breathing, any of that kind of thing because of that. And you can do it yourself, actually, if you're doing the tapes and so forth that you're going, put it across your face, go full on, and you'll see that. And then try and take a deep breath. When we take a breath, we close our mouths, and you'll feel the soft palate, the soft tissue in our mouths rise. That's the volume to your lungs, right? People don't realize that. People think when they need a lot of air, which they will if they run a marathon, it's the, well, when you're sleeping, you don't have those kind of mechanisms. I can't hold my breath for 4 seconds in the middle of the night and so forth. So what you're looking for is that the NG tube and anything, the taping that's going on, right? You tend to have a, and that can be hard, especially too if you don't realize if your child has a deviated septum or anything like that you're going through. Now the NG tube goes down the esophagus. That's the weight. And I know, guys, it seems like it's a couple of ounces, but when you're trying to go into tummy time, you're now trying to lift the tube. That is a different sensation than going into tummy time. And even just the plastics can irritate with the vomiting. So I just hope you're working with the good GI on that. Keep an eye on the hydrocephalus. I'm going to pop up, I have another video that I have showing how the different aspects of the brain can cause this, what's going on. But I want to go into my baby doll and talk about what's going on with, with her. Now, first of all, you had 6 weeks in the hospital, right? 6 weeks in the hospital, I'm going to assume had something to do with breathing. So I want you to do the breathing course. I get it that you might be okay now with breathing, but because of the way the child was positioned, and this is why you're not getting a lot of movement, she's lost her ability for her spine to breathe. And what does that mean? Even right now, if I was to go like this and breathe, right, I should not be breathing where my chest has to force air in and lifts me up. I should be breathing where, again, my spine lifts and comes back down. You will see this problems with articulation, the skeletal system with any child with CP. But again, it's almost to her like she's wearing a corset, and that's why the vomiting's so bad. I believe she's so tight in the chest right now that what we would have a burp and our chest expands, she's burping and just creating like this volcano vomit. And that's where you're having the issue. So what is being treated as reflux really is the rib cage isn't giving enough space for that. It's sort of like at the corsets in the Victorian ages and so forth, where women would faint and so forth, having that because again they were just so constricted in there. We're just not meant to have these things, but she's doing it just through her skeletal anatomy. And guys, this is also why too this is why I do video evaluations. Please be careful when you're watching someone else's child and you're doing a comparison like of a back arch. Everyone has a different story, but what I'm looking for, and I do this all the time because I get emails, about, having consultation and what it's going to, if I don't see a video, I need to see where that child is processing movement. Right? Some kids have more, like I have to do a video review today, are just more visually impaired than others. And but again, we have to undo the medical things that are going on. Hi, Teresa. And then what also I want you to work on, Emily, and I know this is a lot, okay, but we need to get her going. Same thing, I'm not worried about CP and all that as much as when I'm hearing she just literally has to be woken, right? That's where we need movement. As always, I'm going to recommend the newborn movement assessment for you to understand. But you're going to see again where the NG tube is. This is where you're going to have the most opinion from her body about where she can move and can't move. Because right now you've got failure to thrive, you've got hydrocephalus, and she's trying to lift this NG tube. And that's difficult. And again, I really hope you're working with a good gastro. But normally I would recommend my tummy time course. In her case, I'm going to go after my swallow course. The swallow course in particular, what I want you to imagine and work with, you don't have to imagine because she's got the tegaderm. I need all these cranial bones moving. They need to cross a midline. This is stuff, guys, you're going to learn in Scotland at the beginner's touch for those of you who are meeting me there. But you need to work with that crossing of midline. You need to, so take the course, but add in your finger work. I really hope you're more so in the worried parent support group, but that you're getting all this information. But even with the tegaderm there and not there, again, like I mentioned in the breathing, all this has to be done. But even if in the NICU she had cannulation, we've got to get that hyoid bone to start working. And this is where you're having issues with the tongue. Unfortunately, with cannulation, so the cannulation goes around the ear. They cinch it here. They've changed it a lot where the tubing goes out, but if they cinch it here, this is the only bone that floats in her body. Everybody thinks that bones anchor muscles. No, it's the movement of bones, and this is where people get off and don't understand reflexes. They think reflexes is, again, a muscle. What the reflex is meant to happen is the bones are learning how to move, right? And from the bone movement, or skeletal movement, it's teaching the muscles. Muscles don't create movement, they respond to movement. And they do through the skeletal system. And that what truly is a reflex. It's not a lizard brain thing. And that's where a lot of people have been doing reflex integration forever, and they're not getting anywhere because there's no tonus in the skeletal system. And that's what you have to go after. Right? And this is something, again, we're going to be discussing in the Beginner's Touch workshop. So when you're going into those kind of movements, right, and especially when you have tape and that, and again, I'm not trying to be disrespectful to your daughter, but I'm trying to say is your daughter is trying to compensate past medical equipment. So I want you to go up and down her body as, thinking about where she had the IVs and the ankles and all this kind of stuff that went on. All those things, you have to almost undo the medical procedures. I hate to say that they were there to save her life and then go on. But that's what you're working on first. Don't go past that. I don't want you going past right now the head to swallow course, because we need to get her system breathing. So you're going to do the newborn movement assessment, the breathing course. The breathing course is good too because it'll help develop your touch. We need to get that spine and those ribs breathing. Right now she's right, and that can't happen, and that's why again she's here. You know, she goes again to have that vomit. It's just going to explode. And that's why you don't get warning as well, because she'll either try and swallow, but if she can't swallow, see, the breathing happens first, but the breath swallow ratio happens. Just like I've been talking now for 5 minutes or whatever, I know how to swallow, not swallow, and I regulate it. Well, babies are different. So if she's going to swallow and it's too tight to get in there and there's a burp in there or whatever, again, we would burp, you know, she's burping, burp, and that's where you have that problem. So that's where I want you to starting off with. Emily, I just saw you join. This is all going to go recorded out so you can watch this. That's what I want you working on, but then I want feedback. So, and I'm going to ping you for one more video about the brain work. When you have fluids on the brain, it changes the movements. But right now, we need to get her where she wants to initiate movement. And then we can go on to milestones. That's going to come first. And it's going to be a little bit laborious on you, but we've got to do this for her. Because I don't, like I said, it's the sleeping and the non-movement that bother me more than any concerns for CP. I hate to say it this way. The CP, any malformations to the brain, trauma or not, you will be looking at that diagnosis. Take the money and run. It's what's going to get you services. It's what's going to get, if you need Social Security, all that. They understand that. They're not going to understand that your daughter maybe later on has 15q deletion and you've gone down with genetics. And I would be looking at genetics as well, just to get that person in your pocket. Genetics is completely different than neurology, and they have a different set of eyes. That being said, though, you're here for the movement part, and that's where you're going to be working on. And like I said, I'm going to tag you on another video that I did about working with the head on that. And that's where you're going. If you have any questions, ping me on that, and we'll go from there. I want a follow-up video within a week or two, probably 2 weeks, so I can see what's going on. Thanks.